expressed clearly in a way that you are very sure about what you are saying.
Perfect. Categorical is the correct choice. Which of the following is the most well-known of the personality disorders? Clear logic. Your choice borderline personality disorder is sound and 100% true. In borderline personality disorder, there is a % rate of parasuicides. Well reasoned. 70% is the correct choice. Dash is a pattern of disregard for and violation of the rights of others. Well picked. Antisocial personality disorder is the correct answer. Which personality disorder does not belong in cluster B? Dramatic, impulsive.
Nice work. You chose paranoid, and it is correct.
Most of the hallucinations of schizophrenia patients involve the sense of. Strong choice. Hearing is the right answer. Borderline personality is prevalent in what percentage of the population? Sharp thinking. 6% is the right choice. Able to change when necessary in order to deal with different situations. Excellent. Adaptive is a brilliant choice.
Which of the following is described as shallow? A victim or princess?
Exactly. Histrionic PD makes sense, and it is right choice. Which personality disorder does not belong in cluster C? Anxious, fearful. Good thinking. Antisocial is the right answer. A preoccupation with the fear that one has a serious disease is called. Smart move. Hypochondriasis is an accurate answer. Folks with this personality disorder have an overactive frontal lobe. Right choice. OFD is the best answer. Which personality disorder does not belong to cluster A? Odd bizarre. Correct response. OFD is the most accurate answer. Lack self-reliance, self-esteem, and let others make their choices. Well done. Dependent is the right choice. Which of the following is described as distrustful and suspicious? Great thinking. Paranoid PD is the right choice. To recognize exactly what an illness is or the cause of a problem. Bravo, diagnose is the answer. The ability of something to produce the results that are desired. Nicely done. Efficacy is a solid answer. To decide which type or group that someone belongs to. Smart pick. Classify is the correct choice. Which cluster is characterized by anxious and fearful behavior? Orm. Right again. Cluster C is a valid answer. Which of the following is not a cluster C personality disorder? Valid point. Antisocial personality disorder is true. What factors may influence the development of eating disorders? You chose all of the above, and it is correct. OT interventions for personality disorders should include dash.
Nice selection. All the above is the correct and valid answer.
See themselves as highly important and unable to love others. You're right. Narcissist is the correct answer. Which neurotransmitters are related to binge eating disorder? You got it. Your choice serum is right. Which of the following is not in the dramatic erratic cluster? On track. Paranoid PD is the correct answer. behavior or appearance that is odd, eccentric, or peculiar.
Good job. Your answer schizotypal PD works well here.
In the same order as the people or things already mentioned.
Excellent choice. Respectively is the right answer.
How common are personality disorders in the US population? Great job. 9% is the accurate answer.
Which of the following is in the anxious, fearful cluster? Correct. Obsessive-compulsive PD is the right answer. To name or describe someone, something in a particular way. Solid response. Label is a valid choice. Which of the following is not a symptom of schizophrenia?
Right choice. Panic attacks is the best answer.
Action taken to improve or help a problem, illness, etc. Sharp thinking. Intervention is the right choice. Two or more things, phenomena happening at the same time. Bravo. Cooker is the answer. To cause something, especially a problem or difficulty. Valid point. Pose is true. Which personality disorder has the highest prevalence? Solid response. Obsessive-compulsive personality is a valid choice. Able to apply to most people, things, conditions, etc. Good thinking. Generalizable is the right answer. An opinion or attitude towards a particular subject. Good job. Your answer position works well here. To guess or calculate a number, based upon evidence. Smart pick. Estimate is the correct choice. Lack care or attention towards someone, something. Excellent. Neglect is a brilliant choice. Control of behavior, thoughts, work habits, etc. Nicely done. Discipline is a solid answer.
Reckless disregard for safety of self or others.
Excellent choice. Antisocial PD is the right answer. What is the ratio of women to men that have BP'd? Well reasoned. 3:1 is the correct choice. At what age does bulimia nervosa tend to occur? Nice selection. 16-18 years old is the correct and valid answer. To show that something is right or reasonable. Correct response. Justified is the most accurate answer. The DSM-5 defines personality disorders. Exactly. 10 makes sense, and it is right choice. Which of the following has magical thinking? Great job. Schizotypal PD is the accurate answer. To be the explanation or cause of something. Strong choice. Account for is the right answer.
Completely different or opposite in meaning.
Great thinking. Contrary is the right choice.
Importance, respect, and value of a person.
You got it? Your choice dignity is right.
Suspicious and mistrustful for no reason.
Nice work. You chose paranoid, and it is correct. Which of these are not a symptoms of BP? Smart move. Extreme feeling of joy is an accurate answer.
Also known as sociopath or psychopath.
On track. Antisocial is the correct answer.
Happening repeatedly or for a long time.
Clear logic. Your choice persistently is sound and 100% true.
A very small amount, less than enough.
Well done. Paucity is the right choice.
Not behaving or working normally. Correct. Dysfunctional is the right answer. Variety of similar things. You chose range, and it is correct.
Risk factors of BPD are:
You're right. Hereditary predisposition, stressful childhood is the correct answer. At the beginning. Perfect. Initially is the correct choice. Injury or damage. Well picked. Harm is the correct answer. As a group. Right again. Collectively is a valid answer. How you will get all these quiz questions in PDF books format?
strong choice. Contact Narayan Changda is the right answer.